Namaste. Welcome to part two of Questions of a Therapist. I Feel Lost. So far in part one, we have covered about how the new therapist and even the most seasoned therapist may get lost in between the process, sometimes owing to the lack of inadequate structures which they are trained into, maybe to do with their own resistances, and probably many more other aspects. Somewhere in the part two, we are covering more information about this with our subject expert, Dr. Himanshu Vaidya. Namaste, welcome back, sir.
Namaste.
It's a very interesting topic we are having a discussion today on, and this episode, I think most of the new therapists are going to relate to. So, in this part two, we were somewhere at the point where we wanted to explore that beyond ethical values and the morality, does it involve the inner workings of the therapist himself or herself too in the process of being lost or being found again?
Yes, that's a good way of putting it, because you are never lost forever. You always find yourself back into therapy.
True.
Inner workings of the therapist are very, very important here. Let's take a few examples. First, say the therapist himself has an unresolved, I am not good enough. And that leads to catastrophic thinking. So the moment the difficult case comes, and if the person who comes to you not only is a difficult case, but let us say he is a good achiever in his life, the combined weight of the two can release catastrophic thinking in the therapist, leading to such high anxiety that he feels lost because of his own anxiety. His own I am not good enough, his own catastrophic thinking, and combined with the weight of the achievements of this patient. So the person cracks under the weight and he feels lost because of it, number one. Number two, we discussed about the conceptual difficulties because of which you may feel lost. And that is true for everyone. Nobody can have perfect knowledge. So crossing a limit, after some limit, you will feel lost in some cases. That's perfectly understandable. But we are referring to something which is more on the pathological side of feeling lost.
Right.
And there we have to look at the non-verbal side of therapy. And this is something which most people lose a sight of.
Please elaborate more, sir. What would be the non-verbal?
Yeah. So this takes us into a larger area. Sorry. Sorry. This takes us into a larger area of how healing happens. We have discussed it in a separate lecture, separate discussion as to how healing happens. And similarly, a smaller question, a subset of that question is how therapy happens.
Right.
And when we look at this question, it happens in two ways. One is the verbal part of therapy, where the patient expresses himself and feels better. There is a soft catharsis, soft closure, a soft analysis and thinking out of what needs to be thought out. Acceptance of one's expression, non-attack of one's expression, and all these things are happening. So this is the verbal part on part of the patient, the free association, the self-expression. And of course, in that expression, the person also thinks out. The person also feels out. The person gets more clear. He gets focused. He is able to solve many of his problems on himself when he gets a very supportive, non-attacking, accepting listener. The passive holding. one part of the passive holding. Now, this is the verbal part on part of the patient, because of which some part of healing happens. Another part of healing happens because of the interpretation of the therapist, which is also verbally communicated. So what we call is the interpretation, the core tool in psychoanalysis, interpretation. In CBT, it will go like something like guidance, because they don't go so much into interpretation as much into guidance.
Maybe the Socratic questioning.
Yeah, questioning and followed by guidance.
Yeah.
So in psychoanalysis, the prime tool will be the interpretation. Now, this is a verbal part of the therapy process on the part of the therapist. So the verbal part works both ways. There is a verbal part on part of the patient. There is a verbal part on the part of the therapist. Now coming to the non-verbal part. There is quite a big area of psychoanalysis which works non-verbally, where people don't focus attention upon. Often they don't even understand it. And even if they understand in theory, they find it difficult to apply in practice.
Application.
So that has to do primarily with three things.
Okay.
The transference, counter-transference issues, the projective identification issues, and the holding aspects. So the transference, projective transference, the transference, transference, counter-transference issues, they are non-verbal. Some clients may be able to speak out their transferences.
True.
Some will not. So some might say that I feel you like my father, or I see a father in you. Some will not say it, but you will start feeling like that. You will start responding like that.
True.
So that is where the non-verbal comes in, that the transference, counter-transference is non-verbally acting in many cases. In fact, in most cases, very few cases, it will be literal, verbalized, literally. So it is indicated, or it is just either it is indicated verbally, or it is completely non-verbally communicated.
True.
So there is a very large area of communication happening non-verbally, which is not even indicated, not even hinted at. It is just, it happens independent of the verbal communication. So first is the transference, counter-transference issues, which are non-verbal. Second, projective identification, which also is largely non-verbal. And the third is the holding aspect. In projective identification, often it happens that the patient feeling perplexed, the patient feeling anxious, the patient feeling attacks on his linking processes, transfers it to the therapist, and the therapist feels lost.
The numbness they usually refer to.
The patient has a heavy head and you start feeling a heavy head. The patient is feeling anxious and you start feeling anxious. So this is the projective identification part, where the perplexity, the confusion, and all the three are different. Perplexity, confusion, and the thought difficulties. Any of this can make you feel lost. And as we saw before, the psychoanalytic causes of perplexity and confusion are both different. Both are related to the split, but they are different. In some cases, you may even find it related to the primal scene memories or the Oedipal memories. Mostly it will be related to the split, what we saw last time in discussion. Okay, for perplexity, the problem is of too rapidly opening and closing of the split. And in confusion, the difficulty is not having the split opened at all adequately at any point in life. At least not recent enough to be effective right now. So this is the projective part of it, that the patient communicates to you non-verbally what he is feeling. And if he is feeling lost, you will start feeling lost. And the last is the holding part of it, which is also very important part of therapy, the non-verbal part of therapy, where you are holding. And especially in active holding, the difficult emotions are put into you. You don't act them out. And this takes quite some practice. That the person puts anger into you, and usually you will act out that anger. It will come out in your tone, in your language, in some way or the other. But if you can recognize the projective identification, you can deal with it either by pure observation, allowing your system to process it, or to interpret it, or to bring it up in discussion. So
there is a slight confusion personally I'm having here. So it's like a transference of something happening. In this particular example, for example, there is a transference of anger, right? Because there is a process of projective identification, and the therapist provides the active holding to that, where he feels, but he doesn't respond to. This is how the stepwise thing you're talking about?
yes, let us take
Okay.
2 examples
Okay.
of active and passive holding.
All right.
Let us take this same effect put in by projective identification. Situation 1, anger is put into you and you feel angry for no reason. And you know it is put by the patient, so you keep observing it and you don't do anything, and in a few minutes it goes away. That's a passive holding. Situation 2, you are able to process it, and you are not only able to not act on it, but you are able to, after a few moments, be happy and bring happiness in your tone and talk to the patient in that good tone and the good language. So what you are doing is you are converting that input anger into a good output.
So basically, we interpret within our system, we do not reveal it to the patient.
So this is, you are acting like a system of processing, taking in difficult input and giving out a good input.
Right.
Taking in a pathological input, giving out a nourishing input. And this is an active holding. There is another way of dealing with projective identification, and that is to bring it up in discussion. Which is between the two. It is like, first you do passive, you don't act upon it, but you bring it up in discussion. That it seems there is some anger in you. What is it about? Can we talk about it? Now the surprising part is, he has not told you anything. You have found it out by projective identification.
Projective identification.
But surprising part is, when you bring it up, most people don't ask this question, how do you know? They just get in tune with what you are saying and they start exploring themselves. Very few people will come to realize it, that I have not said this. How does he know? So it's a very interesting part of that process. So this is where, if you know this dynamics, you will not feel getting lost. So this is where the inside of the therapist, how well he has been trained to observe and use his insight in the non-verbal area and not get dragged by these forces. Counter transference can drag you in. projective identification can drag you in and make you a player. Right? So this is where that part comes in. How do you keep away? How do you maintain your independence and not get entangled into the chains which are thrown non-verbally by the patient? Unknowingly, he also does not know. He's unconsciously throwing chains at you of non-verbal type to chain you and get you entangled into the process and make you a player.
Okay. That's not a defense.
This is a part of the pathological process. It's a part of the defensive process. Because he wants to act out all that is inside instead of observing and analyzing and feeling it and letting it go. So this is where, if you know, you won't get lost. Right? And apart from, there are two parts. One is getting lost, exactly the focus of today. Another part is losing one's way, which is a broader area than what we are talking about today. So you will neither get lost nor lose your way.
Talking about the so typical aspects of school of psychoanalysis, the projective identification, the transference, not to miss the free association management. How do we get lost in free association management? Because many of times, even in dream analysis or even in the narratives of the therapy, we ask the clients to have free association, and sometimes it actually tends to shift the entire dynamic if it is not being caught in the right way. So what are the possibilities there where the therapist actually get lost with the free association? How to manage that?
Yeah. So here again, the knowledge and how sorted the therapist is from inside that comes in. Because the first important point is, you can easily get your, it's a very good question, because psychoanalysis works on primarily on free association, and one can easily get lost into free association. It's one of those points where most people get lost in the beginning of the career. Because the core is this, that the client does free association and the therapist has to do free floating attention. And the free floating attention at some point touches the free association. And that is where the knowledge and the intuitive ability of which part of free association to pick and discuss more upon, go deeper into, and which parts to let go. There is no way you can discuss every bit of free association.
Again, there are a lot of non-verbal signs there.
Even in the verbal signs.
Right.
Let us say you just focus on the verbal part. If you were to pick up and go into every component, you just can't get out of the therapy room. It will go on for 7 hours every day. Right?
Absolutely.
So out of so much said, we pick up some bit and go deeper into that part, leaving aside other things. So this selection is based upon knowledge and experience and intuition, and partly on how sorted you are from inside. Because if you are not sorted, your pathology will make you pick up certain unimportant and difficult parts and put them as important. So one part is this. Second part is, often people don't
I would
realize.
like to interrupt you here, sir. Whenever you're talking about this important and unimportant part of the therapy, is it to do with the goal of the therapy which decides what is important and what is unimportant? One, or is it to do with the extra information generated due to defenses or resistance?
It's primarily
or
the
both.
second. Yeah. So primarily the second, because
Okay.
Whatever school you are following, right, based upon the limitations of our knowledge, we will segregate into important and unimportant. And what we think is unimportant, some other school may think some part of it is important.
And those who are applying all many schools at the same time, so they make a list what falls where.
They have a larger basket of
Basket.
the important.
Fair enough.
Their basket is more populated in terms of what is important, because they can
Right.
do from multiple schools.
Sorry for interrupting there.
It's a good question. So the free association, people who are trained in psychoanalysis in a Puritan way, they believe free association is something sacrosanct and all good. That you overcome defenses by free association. And something leaks out. And from there, you can pull that whole thing up from the unconscious. Ironically, many people in psychoanalysis would not know, but those who are in other schools, they know, primarily ISTDP, they are very clear about it, that free association itself can be used as a defense.
Many times.
And this was also appreciated by Lacan, even before ISTDP, that much of the time of the session is used by the psyche for free association as a defensive measure. So free association, the primary idea was that it will always be important what comes up in the session, either directly or in transference. And free association is like water which you throw in a sink, that wherever you throw, ultimately it will have this winding movement down to the tube. So wherever you are on the surface, finally you will go down the tube. So that spiraling movement will be there, that you may start at the top of the sink with free association, but when you start analyzing it, slowly you start moving towards the surface, and finally you will go to the depth of it. That was the assumption, that however far the free association may be from the core content in the unconscious, if you analyze it, it will lead you to the unconscious, the core difficulty in the unconscious. Now, this is true for a majority of free association entities, but it can also be used as a defense. And when free association is used as a defense, then the selection becomes even more important. So that we don't spend time in getting lost with defenses. Otherwise, we are analyzing precisely what we should not be analyzing.
True, and it's such a waste of time at times.
Correct. So we get lost here in futile application of knowledge. It is not that we don't have knowledge or we cannot apply, we are applying it at the wrong place. So the results don't come. So the work is happening and the results are not coming. It is not that you are not applying psychoanalysis. Just that the application is on something which the defense wants you to apply on, so the core remains untouched, undiscovered. So you get lost here because of the cleverness of the defenses. So it's very important to manage the free association very judiciously, and where necessary, bring yourself in to direct the free association. Now, this is something very difficult in Puritan psychoanalytic background to digest, because it's self-contradictory in a way. That if you start directing, you cannot have free association. It can happen only when you don't. Right? But in exceptional situations where the free association is being hijacked by the defenses, right? Extraordinary problems call for extraordinary solutions. And there we have to get into this dilemma of directing the free association. And we have to be as sparing and austere as we can be. But it may be
In fact, it
confusion.
can be a guiding map where the unconscious is resisting something to be revealed. The free association covers up. It can be a good guiding map, but there is something underneath.
The greatest difficulty here is we should not allow our pathology to guide. Because once you become a player, once you start directing, you have become a player in some way. And once you become a player, you have to be sure that you are not playing the game of your own unconscious. That the player is an enlightened player, not in the grip of his unconscious, but very clear about the objectives because it's needed. So this is a very important aspect of conducting oneself in that exceptional situation of directing free association, so that because it has been hijacked by defenses. So this is one more area where you can prevent yourself getting lost, and then you have to make sure that you don't end up getting lost in the game of your own unconscious, because it's a sliding slope. When you start directing, it's a sliding slope, right, to directing it completely and all the sessions. So we don't normalize that. We be aware that it's an exception, and in the exceptional situation, we are doing it for a finite period of time. And the moment the defenses are overcome, we come back to that position of the uninvolved blank screen. Because that is the real position. It's an exceptional thing which is making us direct the free association. That is one. Second, getting lost happens in free associations, where it's interesting to know that just as the patient is making free association and we select some free association to go deeper, that selection is partly based on knowledge, partly based on experience, partly based on supervision, but a lot of it is based upon our intuition. And that is where how sorted we are becomes very important. That can we tune into the patient and at the same time use our knowledge, experience, and supervision, so that our free floating attention catches the free association at the most profitable and productive point. So that is something which one has to develop internally, and more one is sorted inside. And I would even dare to go to the extent of saying more one is spiritually evolved and more empty one is inside, the better one reflects as a mirror. So the question is how clear you are as a mirror. The more you can reflect as a mirror, the more productively you can point out which point of the free association river you have to pick up to go deeper. And then you get better results. And then you don't get lost.
That's a beautiful way of seeing how clear is the mirror.
Right. Because we are reflecting business.
Yes.
We are not into distorting business.
Absolutely. So what, who, and how one can seek help when they're being stuck as a therapist?
First, supervision helps. If you feel lost, go for supervision. I don't know why people avoid supervision so much, but that is first. Second is peer discussions and peer review. People of your age, your experience, have a group with them and share cases. Third,
That too is not put in practice these days.
yeah, it's not. There are too many ego clashes. So it's
Yes.
and there are too many attacks on each other. Because supervision is a very delicate process, you have to convey the shortcomings of somebody as gently as possible. You have to be extremely gentle and extremely soft, not to hurt anyone, because he is coming to you essentially for some shortcoming. But you don't have
The
to
blind
throw it on his face. And you don't have to practice your narcissism to show how big you are.
True.
So it's a very delicate business. You have to be extremely soft and gentle and as indirect as possible, so that the other is not hurt. And because this is not being done, supervision itself is becoming a traumatic activity, that people dread supervision, that they take supervision only when it's compulsory, and that too they dread. And the moment they're out of the course, they never come back, because they dread supervision. They don't see supervision as a happy process, as a growth process. They see it as a dreadful attacking process.
Oh,
It's a fault finding attacking process. It's a ego hurting process, and that's the difficulty. So anyway, the first point is supervision. Second is peer analysis, peer review. Third, in some techniques, video recording is done. There it is possible to self-review.
okay.
With transcript also you can self-review, but it's better with the video. Fourth is to develop more tools, because if you equip yourself with more technical tools, you don't get lost easily. And develop oneself in more schools and spiritually. And the last and very important point is this. I should not have missed it. Good, it occurred to me right now. It is the honesty and openness. Say to the client very clearly that I'm not understanding what you are saying. Can you say something more about it so I can understand it? You don't have to use the words that I feel lost, but you can communicate it in another way, that you feel lost and something more has to be said explicitly for you to get a grip of what is being said.
Grip of what is being said.
So be clear about
that is very normal.
Yeah. So be honest and open about it, that what you are saying, I'm sure is important, but I'm not able to understand the gravity of what is hidden as important in what you are saying. Can you say something more about it so I can understand it more clearly and find out what is so significant about what you are saying? So this is a very important way to deal with it, apart from all other tools.
Also by less and too direct interpretations, going slow with the pace, not forcing things, and also not over expecting from oneself also.
Be silent if you are confused. Because if you try to make an exhibition of your knowledge where you are confused, you will end up being a spectacle. So nobody leaves therapy because you have not made an interpretation.
Absolutely.
So just be silent if you are confused. Just let it pass. It will come up. It will come up again. And there's a very old saying in therapy. It says, brilliant interpretation and the therapy ended.
I was waiting for this master phrase.
That often the interpretation is brilliant, but it is too early or too deep or beyond the capacity of the client to take. So the interpretation has to be calibrated. What can be said in the 50th session cannot be said in the 5th session. What can be said to a high functioning client, high ego strength client, cannot be said to a low ego strength client. What can be said to a neurotic client cannot be said to a psychotic client.
But sooner or later, they seek back again. Once they are made peace with the interpretation and some revelation takes place from the unconscious, some process happens post. I've seen most of them take a break and come back again. That's the beauty of it.
So these are some of the ways you can avoid feeling lost in the thick of therapy.
Right. That comes as a very good savior map how to go about when you feel lost, by reminding the basics of the school of supervision, peer discussions, updating oneself, having more tools to operate for, recordings. But if at all a newly trained therapist has to dread of that difficulty, what can worse happen in an early practice?
The worst that can happen is that you end up harming the patient. What we call re-traumatizing. That can be the worst. Second can be the patient leaves therapy and he starts believing all forms of therapy and all therapists are like you and never comes back to therapy in any form to anybody. And he is
losing the faith
then,
in the healing.
Yeah. So he is deprived then of a large avenue of healing. So that also is very sad if it happens. And in India, it's very easy to happen because it's not a therapy mature society. So people don't know that there are different forms of therapy and different types of therapists. So they believe it's only one process and one type of persons. It can be where, or it can be the patient continues, but he feels persecuted, feels more anxious. He can feel rejected, that you have not held him where you should have held him. Or you make a wrong intervention, or you give a wrong advice, or finally the patient leaves. So you lose the patient, but for the patient, it's a tragedy. So not feeling understood, and he returns feeling even more lost. So he's more lost than you are lost. So all this can happen if it goes wrong.
And that's a tragic phase, to lose hope in healing.
Yes, it is.
Is it not a task then by itself to keep finding oneself and not get lost every now and then?
It is. It takes quite some experience and honesty and work to not feel lost and find oneself, if not once and for all, for at least a long time to come.
So, as usual, such a revealing, refreshing, reassuring, and opening up of great inner space the discussion has been.